Danger. Before approaching the casualty, always make sure the area and bystanders is safe. Make sure you do not put yourself in danger when going to the assistance of another person. Response. Check if the casualty is responsive or unresponsive. As you approach them, introduce yourself and ask them questions to see if you can get a response. Kneel next to their chest and gently shake their shoulders. If the casualty opens their eyes or gives another gesture, they are responsive. If they do not respond to you in any way, they are unresponsive and should be treated as quickly as possible.
Breathing. Once the airways are confirmed to be clear, determine whether the person can breathe and if necessary, provide rescue breathing. Circulation. If the person involved in the emergency situation is not breathing, the first aider should go straight for chest compression and rescue breathing. The chest compression will promote circulation. This saves valuable time. In emergencies, they are not life-threatening. The first aider needs to check the pulse.
Check to see if the person is breathing and has a pulse. If not breathing, start chest compression. If the victim has hairy chest, shave hair using razor. Add hair pads to the victim's chest. Allow the AED to analyze the patient's heart rhythm. Make sure no one touches the person as the AED delivers a depression shock. Continue hand CPR after the shock has been delivered.
It is essential to determine if the person has any other physical injuries such as looking for damage or other challenges. Once they start breathing, as this ensure that the place is safe for you, the patient, and the observers. Check to see if whether the person is alright and if they able to open their eyes. If they respond, you can leave them in the position while you wait for assistance, as well as always checking for their breathing, pulse, and level of responsiveness.
First, we need to control the bleeding. Apply pressure on the wound until bleeding stops, and never remove the impaled object. We need to leave it in place as we found it. When the bleeding stops, we need to wash the wound with warm water and mild soap. Lastly, we need to dress the wound properly. We need to tie it on so that the dressing will be held in place. After all that, try not to move and wait until the patient gets into the hospital.
Burns are tissue damage brought on by heat, chemicals, electricity, radiation, or the sun. Steps on how to treat minor burns. First step, cool the burn. Hold the burn area under cool running water. Remove rings or other tight items. Try to do this quickly and gently before the burn area swells. Third step, don't break blisters. Fluid-filled blisters protect against infection. Apply lotion. Once a burn is completely cooled, apply moisturizer to help prevent drying. Bandage the burn. Cover the burn with a gauze bandage or clean cloth. Last step, Take a pain reliever, such as antibiotics, to help relieve the pain. Stop the bleeding. Control bleeding with direct pressure elevation. Use an absorbent clean dressing to hold pressure and an open avulsion injury. Wash the wound. Once bleeding stops, clean the wound with running water. Apply antibiotics. Apply an antibiotic ointment to the wound. Use dressing or bandage to cover the wound. The goal is to protect the wound from outside elements as it heals.